Today sees the publication of the second Francis report into the appalling events that went on at Mid Staffordshire Hospital. The first report covered the issues around the hospital itself. This more second report talks about the way in which the system as a whole responded. And it's really important reading for people both inside the NHS and outside. And whilst over the next few days there'll be enormous discussions and controversy about all of the things that Francis found, it's important that we in the NHS reflect soberly and sensitively on what happened there and what the NHS needs to do, what action it needs to take to make sure such things never happen again. One of the things that Francis talks about is how the NHS is valued by the people of this country, how they regard it as a really, really important institution that provides great care, which is full of highly motivated staff who want to do the best for patients. But he also talks about when things go wrong. The NHS treats over 1 million people every 36 hours. And for the vast majority of those people, the care they get is great and their outcomes are really, really good. But for some patients, the NHS fails them. It fails the patients, but it also fails to come up to the standards that we as health professionals want our patients to have. And when that happens in health, it is different to what happens in many other parts of society. Because when the NHS fails you, it can have really, really devastating and serious impact on individual patients, their carers and their families. And so it's really important that we do everything that we can, first of all, to prevent those things happening, but also when they do, to make sure that we support and help patients and their carers through the difficulties that ensue. When the first Francis report came out, one of the things I did, and I can remember it very vividly, is take away the patient stories that he published at the same time. I spent some time reading all of them, and harrowing stories they were about the way in which the NHS had failed those patients. And one of the things that I thought about that when I did it, in fact I did it in practice, I wrote to all leaders in the NHS and said they must read these stories. It's really important that leaders in the NHS understand the scale and nature of what can happen when a hospital goes wrong. All you can do at one level is to apologise to the people of Stafford of the terrible suffering that they had in that hospital. But saying sorry is not enough. You need to organise, we need to get ourselves into a place where we can start to take the action, first of all to prevent those things happening, but when they do happen, to put them right as fast as we can. And it is incumbent on all of us in the NHS to respond in that kind of way. If you think about since the Mid Staffordshire events happened, finishing in 2007-8, a lot's happened in the NHS. We've improved services in all sorts of ways. We've tackled the scourge of hospital infection in a very robust way. We've made real inroads in terms of reducing infection across the country as a whole. We've saved literally tens of thousands of lives by the changes that we've made to stroke services, to coronary heart disease services and cancer services. We've improved access to patients so they can get their cancer services quicker than ever before. But we need to do more. Already we're thinking about the way in which we can take the service forward. We're thinking about how we can get doctors and nurses much more engaged and leading the way in which we plan and organise services across the NHS. We're developing clinical commissioning groups in every locality which enable us to do that. We're also thinking ahead about how we can give patients more clout, how we can give patients a much greater position in the NHS going forward, how we genuinely can become patient-led, how we can give them more information to help and support them making the decisions that they do, how we can make care and compassion more part of the way in which the NHS operates, the great work that the Chief Nursing Officer is doing in this area at the moment. And we're thinking about how we can use feedback from patients to improve services across the NHS. This is a very, very important moment for the NHS. This is a moment when the NHS needs to take stock. But it needs to move forward quickly to take the kind of action will both improve services to patients and improve their experience of those services. It's incumbent on all of us to think deeply about our role in this. What are we individually going to do to improve services for patients? How we, in the boards of organisations that are responsible for making sure great services are given to patients, how we who are involved in the commissioning activities, whether it be clinical commissioners or at a national level, can start to work to improve both the quality of service for our patients and their experience of the NHS going forward. This is a critical time for the NHS, and I'm sure people can respond positively to this to make sure that we continue to improve the services for our patients.